Hello, everyone. Thanks for joining us. I'm Cindy Smith, and I'm so privileged to have my nursing colleagues with me today who are going to share for Nurses Week how they answer the call. Welcome to today's webinar. Thank you for joining us. My name is Cindy Smith. I am a registered nurse and I'm the Executive Director of the SRNA. And I'm very pleased to facilitate the webinar today. Today's webinar is happening on Treaty 4 and 10 land. And I want to acknowledge the harms and mistakes of the past and to recognize SRNA's partnership with Indigenous and Métis people in the spirit of reconciliation, collaboration, and respect. I would like to wish you all a very heartfelt National Nurses Week and thank all of you, both the panelists and participants, for your dedication to our profession. You play a very important role in the healthcare system in Saskatchewan, and your hard work does not go unnoticed. I am really honored to be joined today by 4 fellow Saskatchewan nurses who are here today to share their experiences and how throughout their careers they have answered the call and what that truly means to them. So welcome panelists, Suzanne Nicolay, registered nurse, Rena Sutherland, nurse practitioner, Jamie Mantesso, registered nurse, and Kimberly Lane, registered nurse. And welcome to all the webinar participants that are joining us today. So I'd like to open the webinar by having each panelist introduce themselves and to share a brief description of the work they do. So Suzanne, let's start with you and then followed by Rena, Jamie, and Kimberly. So Suzanne.
Thank you, Cindy. Hi, everyone. My name is Suzanne Nicolay. I'm a registered nurse. I currently live and work in Treaty 4 territory. I live in Regina, and I would just like to acknowledge that it is home to the Cree, Saulteaux, Lakota, Nakota, and Dakota peoples and the homeland of the Métis. I have the great honor to also do much of my work in First Nations communities, and I offer this just as acknowledgement of the truth and reconciliation and my commitment to that. I work with a program called Wellness Wheel. It started as a not-for-profit agency of healthcare providers visiting First Nations communities in central and southern Saskatchewan, offering primarily HIV, Hep C, and then primary and chronic disease care. I also do some work in the city of Regina with 4 Directions and with a pharmacy on 11th Avenue. And I think that's all I'll say right now. Thank you.
Rena, go ahead.
Good afternoon, everybody, and happy Nurses Week. My name is Rena Sutherland, and I am a nurse practitioner who works in Northern Saskatchewan in Treaty 10 in the community of Stanley Mission within the Lac La Ronge Indian Band. For those of you that don't know, Stanley Mission is approximately 5 hours northeast of Saskatoon, and obviously is the most beautiful place in Saskatchewan. In my work, I work within a team of registered nurses with additional authorized practice, as well as LPNs. We provide care across the lifespan from preventative to screening, chronic disease management, episodic illnesses, as well as a wide range of public health within the community. We utilize RN specialty practices in our everyday work, and this allows us to optimize the delivery that registered nurses can provide to the community members. We also provide on-call after-hours emergency care, as our closest hospital is approximately an hour away in La Ronge. I can definitely say it is a very strong team. We work very collaborative and has dynamically adapted to the community's needs prior to the pandemic as well as with the pandemic. So thank you.
Thanks, Rena. Jamie.
Hi, my name is Jamie Mantesso and I'm a registered nurse. So happy Nurses Week, everyone. I'm a member of the Faculty of Nursing at the University of Regina, and I work within the collaborative program that's also partners with Sask Polytechnic. We have undergraduate students getting their BSN degrees, as well as we have a nurse practitioner program. And we also have a bilingual option, which some of you may not know. So we have bilingual students studying in the program. And I'm excited to tell you a little bit about how we're answering the call. So thanks for having me.
Thanks, Jamie. Kimberly.
Hi, good afternoon, everyone. My name is Kim Lane. I am a registered nurse, and I currently am working as a manager in primary healthcare in Regina. So I am supporting programs and staff that are providing care mostly within home care, some chronic disease management, public health, and then currently there's been a large focus as well on COVID vaccinations and the rollout of that. So I'm very privileged and thankful to be here today for Nurses Week.
Thanks, Kim, and thanks to all the panelists. And as you can see, we have such a great diverse panelists. I'm looking forward to the discussion today. So we will begin with our questions and discussion. So this year, as you all know, National Nurses Week theme set by CNA is We Answer the Call. And I know for each of us, this theme may mean something different. So I invite each of you to please describe what answering the call in the best interest of your clients means to you. We'll start with Jamie, followed by Kim, then Rena, and then Suzanne. So Jamie.
Okay. So as a nursing instructor, I would consider our biggest client group to be future nurses. And I have the privilege of spending a little bit of their journey with them as they embark on their eventual careers. So when I think about answering the call in the best interest of nursing students, I think about a couple of things. First, I think about our program and how my colleagues from both U of R and Sask Polytechnic have worked to create and deliver a nursing education to students from all parts of our province. Since our program began, there's been a lot of changes, and we continue to grow and adapt in all areas of our work. So not only do we educate students, but we also carry out research, do a lot of service work within the community, and my cat's here. And we do administrative work as well. But our focus is always on our students and helping them get ready to enter the nursing profession and work with all of you. As an example, some of the work that we've done, our students have went from struggling a little bit initially on the NCLEX to, in the last reporting period, having a 94% success rate on their initial attempt, which is quite remarkable and among the highest in the country. And it's really a testament to who they are as people, as individuals, and eventually as colleagues. So secondly, I think we're answering the call, our students are answering the call. And they're making a big difference in the communities that they work and learn in. Just as one quick small example, I teach a community course, and this past winter, we had a student group at the University of Regina working with students in residence. And a lot of those students are from international locations coming here, and were then obviously couldn't go back due to COVID. And our students were working with them on mental wellness activities, recognizing that isolation was a big factor. And I've heard nothing but positive efforts of the positive efforts they've done, as well as I could name numerous examples. That's just one small one. But I think it does show the type of nurse that's going to be entering the workforce and the kind of good work they do. And I think that's a testament to educators, not only in the SCB, SCN program, but both programs that are running throughout Saskatchewan. There's going to be some really great nurses. So thanks.
Thanks, Jamie. And what a remarkable and rich learning experience it would be. While there's challenges, of course, as a nursing student during a pandemic, but just the rich learning opportunities that it provides. Not many of us can, say that we had that during our nursing education program. So thanks for sharing that. So Kim.
Hi, thank you. I think that answering the call to me right now personally really has meant supporting the staff that works with me with the changes and all of the fear that's really come over this last year, and trying to keep some of our programming going during these really difficult times. That's been a real challenge, and really trying to be mindful of the fact that of how difficult it's really been. And I find that nurses in general, I mean, have always been more than willing to step up and provide non-judgmental, compassionate, empathetic care no matter the circumstance. And I think it was really evident this year how much all nurses, and I mean my staff that work with me, were willing to step up and just continue to provide that care in some of the most difficult circumstances. And I think the staff as well that I work with answering the call for our clients right now, again, my staff are working out in the community right now. And so really not having a lot of control over the environments that they're working in and during really difficult times. Just continue to show up and support all the clients out in the community right now to be able to continue to provide care for them. And I just think that during the pandemic, especially, there's just been so much more of an evidence of our nurses just really stepping up to answer the call, no matter the circumstance we're living in right now.
Great, thanks for sharing, Kim. And you know, mentioned that, I mean, as nurses, we do answer the call on a daily basis, but just that stepping up, and even when your own health is at risk. And so thanks for sharing that. And so next, Rena.
Thank you for that question. So answering the call in my practice setting, I'll go prior to pandemic, shall we say, was, very dynamic in itself, identifying needs within the community where registered nurses could be providing care to increase access to care. And one way that we definitely answered the call in this practice setting was through RN specialty practices. The ability to do RN specialty practices through the SRNA, with the authority coming from the employer, has been absolutely beneficial for the clients and has the clients at the center. I think that has transitioned a bit to answering the call. It has just been constantly evaluating what the needs are of the day or of the moment with how dynamic things have been. This has been very evident given the uncertain times that we are currently in, and one quickly realizes that it can change almost by the hour. I think it's very important when we talk about answering the call that definitely looks different from nurse to nurse. And I think that's the uniqueness of nursing, and honestly, the strength in it just gives me goosebumps thinking about how everybody is using this language of how we've all answered the call, and how that looks different even within different nursing settings. I think it's very important when we answer the call, and we've definitely done this locally, is that we need to take into consideration the physical, the spiritual, the emotional, and the mental, because a lot of the things that we have been focused on have been very physical, public health orders and things like that, and absolutely necessary. But I think it makes nursing expand even more of okay, yeah, it's about keeping them physically healthy, but what about all the other aspects? And just realizing that and recognizing that. So within, most recently as well, we have implemented RN specialty practices in regards to, especially with vaccinations, there was a need identified that we needed to optimize the amount of people to be vaccinated. And with the current protocols that were in place, and policies surrounding that, it limited the amount of vaccinators we had. And so in collaboration with administration and leadership, who have been extremely supportive with RN specialty practices, we have been able to adapt our care and provide safe care to the community, during this time. So thank you.
Thanks, Rena, and thanks for sharing the importance of focusing on the whole being, and while sometimes the focus is on that physical care, it's all the other aspects are so important. So thank you. So Suzanne.
Thanks, Cindy. So I just actually would like to take the opportunity to build on what Rena has said. You know, I've been a nurse for a while, and I guess I always feel like I've answered the call as best as I could. Much of my work has been in HIV care over the last 20 years. And so, you know, there's always been a lot to answer there in terms of, you know, the stigma that exists, and with the increasing numbers in Saskatchewan, for people who don't know, continues to have the highest rate of HIV in Canada, and has had for well more than 10 years. And I know this is something that Kimberly certainly knows as well. It's something that is near and dear to my heart. But I think, you know, at my core, that is who I am, and I think advocacy has always been a part of that. And then with the opportunity to work within and with and for First Nations communities over the last 5 years, it's definitely allowed me to refocus what that means in terms of answering the call. You know, the idea that I know best doesn't exist. The community knows best. The solutions are in the community. And I really feel like while we do try to address the physical well-being of people, that the mental, spiritual, and emotional parts are also significantly important, and even more so now with COVID. I think there's a tremendous amount of isolation. I try not to say social isolation or social distancing. I try to use physical distancing instead. I think in community that is better in terms of how it's understood. That I'm not talking about not being present with people, but I have to maintain that physical distance. I feel like COVID has really accentuated the health disparities and the difficulties in accessing equitable care, or equitable access to care. That is a big part of what we do. We have been very flexible and adaptable to do what the community asks of us in terms of if we can't go out, that we have virtual calls. But as much as we can, we do go out, because there's great value in seeing people face to face. It is appreciated by the members in community. There are things that simply cannot be done over the phone. And I think especially when we're talking about older adults, mature adults, and elders, phone calls are extremely difficult in terms of trying to really get at the root of what people are struggling with. And I think the isolation that I've seen in the city and in First Nations communities around increasing amounts of substance use and overdose has just, it's tragic, and it has taken its toll with many frontline providers, not only nurses, but other providers as well, in terms of friends and colleagues who are no longer with us. And so I think the burden has been great, and the people who have stepped up have done amazing work. And so I just want to acknowledge that certainly nurses have answered the call. I feel like so many of my colleagues do it every day, all day long, but communities have answered the call, and peers have answered the call, and physicians have always done that too. So I think, you know, that collaborative work, interdisciplinary work has been tremendous, and I'm very grateful for that.
Thanks, Suzanne. And that's such an important point to, while we are celebrating Nursing Week this week, we know we do not work in isolation, and we work in teams, and the collaboration and working in teams is so very important, and everyone that we're working with is answering the call. So thanks for that reminder too. That's great. So we'll move to the second question, and you started to touch on some of this in our first discussion, but during this past year, with the introduction of the COVID-19 virus, our roles as nurses have shifted. And so how does answering the call look different now that we're in the middle of this pandemic? Well, hopefully nearing the end versus the middle, but then it did previously. And that also include the impact on your clients. So we'll start with Rena, followed by Suzanne, and then Kim and Jamie. So Rena, go ahead.
Thank you. So I believe the pandemic has brought about a lot of uncertainty, and with that, fear of the unknown. I can vividly recollect the meeting we had in March as a full staff, you know, when the pandemic had been declared, and states of emergency and, all these scary terms that were new to us, or new to experiencing them anyway. And so with that, I think came a lot of fear, and it wasn't just with, obviously the public, but definitely within healthcare providers that were right in the middle of it as frontline workers. I do believe nurses have always been dynamic beings that have been able to adapt to their environment, but the pandemic and COVID-19 has taken that to a whole new level. Things that we didn't think that we were capable of previously, are being done almost as daily routine now. So in my work setting, we have definitely all taken on different roles. As working as a nurse practitioner, I didn't think it would, I would carry on my daily business of seeing patients and prenatals and chronic disease management and doing all these things, until we were actually faced with a clinic outbreak in October, which sent us into a tailspin a little bit, which thankfully colleagues throughout the province, with the help of the SRNA, really stepped up and helped us out in a most vulnerable time. As far as taking on different roles, I think that, answering the call with different roles, while attempting to continue regular care duties was a bit of a challenge that we stepped up to. And this has become, this was in the context of home care nursing, assisting with public health measures, primary care nurses, shifting their vaccination focuses recently, but also needing to maintain, their baseline duties, which is a lot to juggle. And like I alluded to before, a lot of this has been able to be done through RN specialty practices, which has been very helpful. It seems that we have become overnight quite proficient in PPE and infectious disease processes within the clinic setting. We were all, prior to the pandemic, we were all providing preventative care, screening, and episodic treatments to patients. But with the pandemic starting, there were many changes that of what could and could not be processed even at a provincial level. So that definitely had us, adapt to that. And that was definitely changing almost daily. The adjustment for clients was also evident as well, because it was what we would normally do in our practice and what they were used to. I think of, screening practices that we were doing for diabetes and things like that. There was a lot of that was actually temporarily put on hold that we had to adapt to, for sure. I do believe that safe patient care was still provided, and that was the most important. There was great collaboration. We collaborated well with other disciplines like lab services and support measures and the physician group. But I think that just got even more accentuated with the introduction of COVID. So I must say, like, from March to October, we felt like we were a little bit in the clear, perhaps, until October 9th, when our lives changed a bit in Stanley Mission and we had our first COVID case, which, like I alluded to, resulted in a clinic outbreak, put the entire staff on isolation as close contacts. And that was when my role directly changed, by being asked by leadership to step up as the pandemic coordinator. So here I go from being a nurse practitioner doing primary care to being a pandemic coordinator, and fortunately had great colleagues in L'Orange that mentored me through that and helped me answer the call within the community as well. We have since had community outbreaks that we have managed to got through them together. But I think it's important to, just as healthcare workers have felt the impact of forever changing roles, attempts have been made to keep continuity of care with the clients, making adjustments to more virtual care, maybe not in person face-to-face, but definitely in a virtual care model that has allowed for some normalcy. And I have found that the biggest thing, especially with the community, like Suzanne said, the answers are within the community. The community members know, and I commend them for voicing what their needs are, so that we can adapt to that, we can adjust to that, we can do what they need to do, and also in consultation with leadership. I mean, the leaders of the community have also been very good in helping us guide this dynamic water. I think the uncertainty has actually brought us stronger together. Realizing that we need to support each other. This is a time to support each other and grow and take the challenges as opportunities. So yeah, that's all I have to say for that.
Thanks, Greena. And you spoke so eloquently to the, while there was many challenges and there are opportunities, and you mentioned a few of those, and that within that nurses are so adaptable and flexible, and working with your communities is so important, and taking that leadership to do that. So thanks for those lessons, Rena. So Suzanne, we'll move over to you.
Thanks. So I would agree with a lot of what Rena said. I think, the work that were already doing in terms of mobile outreach care, we had to be flexible and adaptable. A lot of the patient population that I've encountered over my career, a lot of them live in chaos, and a lot of us nurses live and thrive in chaos as well. And for those who love that, that's great, and for some they can't, and that's okay too. But I think what's happened with COVID is that there's been so much more chaos and uncertainty. People not feeling it safe to come into the city, not knowing what they're able to do or not able to do. When do they isolate? When don't they? What does it mean to get immunized? Is it safe to come to the hospital now? So many people are actually deferring their care because they're concerned about coming. So I think for us as a team, we've worked really hard to really build on the trusting relationships that we have with individuals, with community and local health teams. We've been able to assist with testing and immunizing and providing basic information to leadership and to local health teams as well. I have the great pleasure to work with Dr. Stu Skinner, who's an ID doc and is the pandemic coordinator down here in Regina. And so he's made himself very available to all of our partner communities when they have COVID concerns, and all of our team actually has been really great like that. I think an opportunity that has come up, even though virtual is not ideal, what it has allowed is actually reconnecting with many people that maybe we weren't connected with because we're doing care in a different way. And so, I think it's taught us that care can be provided in many, many different ways, and it's the right way when it's the way that works for the individual and the family and the community. And so we've continued to provide that care to many communities, even though we may not be able to go in person. We've maintained people on their medications for HIV. We've continued to treat and cure Hep C. We've been continually seeing new patients. I talked with my colleagues earlier today and just yesterday. The patients that we're seeing, of those 3 are going to be admitted over the next few days to get things looked after, because that's the quickest and best way to get them the care that they need. So it's nice to work with a team that's able to actually put things into action when it needs to be. There's always a way when you can work with folks and have that trust, right? So I think those are the things that I think that are amazing. I think we do so much more talking now with the folks that we either meet in person or are on the phone with. We really are trying to take our time much more and just check in with people. How are you doing? And we do that with our colleagues as well. I think we don't always see each other every day. So it's nice when there's someone else actually in the office that you can talk to and see, because it is very isolating, I think, even for us as nurses. Our support is garnered in a different way. And so we're trying to be mindful of not overloading people, but sometimes you just need to actually talk to a colleague about your day. And so I'm grateful. I work with a really great team. And we can just pick up the phone and talk to one another. And so I think, you know, as much disparity as there's been, as much hardship as there's been, there are these wonderful opportunities that have also presented themselves. And so I think that will be one of the really lovely things that comes out of all of this craziness, that hopefully we look back on and are proud of.
Great, thanks, Suzanne. Yes, and in all that uncertainty and chaos, you've still found that there's some gems. And again, it's that connecting this with our colleagues and with our communities and clients. So important. Thank you. So Kim.
Hi, thank you. I think that the real theme that I've heard both Rena and Suzanne talking about too is the adaptability and the flexibility of everyone during this time right now. And I think with pretty much all nurses that I've worked with anyways, and myself, there's been this constantly changing role and nurses' ability to be able to just adapt daily to that. For myself, there was a lot of change, constantly changing programming and policies and directives that we were receiving that we had to implement very quickly for the safety of our staff and for the safety of the clients that we were working with. And for the staff and for all other nurses that I've seen too, you know, their workload often changed daily with some of the vaccination programs that was happening. That was a very, very quickly changing landscape that everyone was working in there, and everyone was very easily able to adapt to that. I think that nurses during the pandemic year as well, like their dedication really shone through in that, just continuing to constantly make that change and be at work all the time, supporting everyone that they work with, their families. And I think that nurses on a whole, their whole skill set really shone through more during this pandemic. I think we all knew, and a lot of people really knew how much nurses were very valued in the work that they did. And I think we kind of talked about this, briefly touched on this before, about how it's so nice to see so much recognition for nurses right now, especially during Nurses Week, with all the work that nurses have done and continue to do. And I think Suzanne kind of mentioned too, like when we look at how the pandemic has changed things for our clients, I think it's really, it's impacted our clients severely with the fear and sometimes with access to care too. And so for us being able to adjust the work that we are doing so that we can continue to offer care to our clients in whatever way possible, I think that's been a real challenge. But I do think that there has been a lot of great things that we have learned from this. And I think that there has been a lot of great work done in terms of clients being able to access care in so many different ways now, that it doesn't have to be as traditional as it was before, with people having to leave their homes all the time and work in ways that works best for us within the healthcare system, that we have been able to adapt and shift how we do our work to be able to support our clients better in varying ways. And I think that's been a really great thing that we may have learned from all of this, as well as what Suzanne said too, in terms of really supporting our colleagues in different ways when we don't always see each other every day too, to really be able to connect with our colleagues, with our clients in these varying ways. And so while this has been a really challenging and difficult time with everything changing so frequently, I think there's going to be a lot of really good things that we've learned that will come from this in the end. And I think that nurses on a whole have really demonstrated just exactly so many things that they can do and how adaptable, flexible, and dedicated they really are to their work.
Yes, thanks, Kim. So a couple things that the access to care comes to mind for me, and how that has in some ways increased for some, and with the virtual options, and then also that kind of moving target every day in terms of, you know, new science, new information, and as well as a manager, I'm sure that was challenging sometimes. So.
Yeah. Yeah, sometimes every day, sometimes every hour, the information changes, and just learning to roll with that and supporting everyone with those changes.
Mm-hmm. Okay, thanks. So Jamie.
Yeah, so at the outset of the pandemic, faculty, much like everyone, faculty and students were scrambling, trying to figure out how they're going to carry on, how they're going to adapt courses, clinical, and students were worried that they might not be able to finish the program. And there was a lot of uncertainty, as was already mentioned. But just to back it up a bit, I remember being a student and trying to study for what's the difference between endemic, epidemic, and pandemic. And never in my life did I think that we'd ever be. I thought pandemics were a thing of the past. And now our students are getting a crash course in what it means to be living and working in pandemic times, as we all are. Our program quickly adapted and we went virtual. We're still virtual. Both institutions were shut down, so things like exams, lecturing, everything was done online. Clinical changed, so students had to adapt to that as well. So there's been a lot of challenges and a lot of uncertainty, but as was already mentioned, a lot of opportunities too. Some of the positives that have come out of it, I think, students have, well, they've been able to be a part of something that, you know, most students can't say they've been a part of, and learn from a lot of varied experiences. I think they are more connected and are supporting one another more than maybe previous groups have. And I think that might also transition into the workplace, and I hope it does, where we're having colleagues that are compassionate and supportive to one another. And you know, and I'd also be willing to wager a bet that maybe, you know, hand washing audits will be a thing of the past down the road. Who knows? But it's truly been wonderful to see how people have come together in all areas of nursing. I think it's really a testament to our profession and, of course, our leadership and, you know, the people that we work with, as well as our families and, you know, friends as well, because nursing can be a very challenging profession, and it can be extremely exhausting. And just to have their support is probably also pretty much helping us through this as well. So that's it for that one.
Thanks, Jamie. And you can all see that I mentioned about how the diversity of all of your roles, and it really speaks to how answering that call does look different for all of us, and always the nursing. There's so many opportunities to work in so many different practice settings and different roles. And so what a great privilege it is to be a nurse. So thanks very much for that discussion. So closing this part of the discussion, I just wanted to ask each of you if you would share a piece of advice that you would give to yourself when you started your nursing journey, however long ago that may be. So we're going to start with you, Kim, followed by Jamie, then Suzanne, and then Rena.
Thank you. Okay. I thought about this for a while, and I think the one thing I wish that I had known more or been able to tell myself is that that you are a more valued member of the healthcare team maybe than you realize. There's never doubt the knowledge and the skills that you bring to each interaction with your clients and with your other coworkers. And I think especially when we look at like interdisciplinary teams now that we're working with all the time, each person, each different discipline brings great knowledge and skills to each interaction, and the knowledge that you bring to the table is so important and different from the direction that anyone else really is looking at it from. And I think that's something that I probably wish it hadn't taken me X amount of years to learn. But I think it's really important for everyone to know. And then the one other thing I thought of that was really important is just really learning to take care of ourselves. I think that as healthcare workers and as nurses, we have a tendency to take care of everyone else. And it's become really apparent, especially during this last year, of how much we're willing to give of ourselves to our work and to our clients and to our coworkers, and ensuring that we're taking care of ourselves, because that's a difficult thing to do. And there's sometimes not always a lot left at the end of the day for us.
Such a great piece of advice, Kim. And yes, as nurses, we look after others and always before ourselves. So such important advice that you've given yourself. So we'll looking at Jamie. Sorry.
No. So yeah, some of mine's similar to Kim's. I started my nursing journey over 15 years ago now. And I guess my advice would be kind of twofold. So one would be that you've picked a dynamic, exciting, and challenging profession. You can try numerous different things out. But remember, as considering that I'm with students a lot, remembering that it takes time to get concepts or get skills, or and everyone learns at their own pace. So I think trying not to compare yourself to others, because it doesn't really matter in the end. Grades, for the most part, really don't matter in the end. I've never had anybody ask me what my OSCE score was when I was starting an IV. So don't define yourself by those types of measures. And I think sometimes students can get caught up in that. Just do your best. And I think that goes with my next point would be when you are 15 years down the line, I hope that you still can keep in mind those nurses, peers, family, whoever it is that you aspire to be like, and carrying that with you as you go. And of course, being knowledgeable and competent is important, but so is being kind, caring, and compassionate. And then that extends to your clients, but also to your colleagues as well. And I think, as Kimberly has already kind of mentioned, it requires you, or what I've learned is that it kind of requires you to prioritize yourself and take care of yourselves too. So that's what I would tell my younger self.
Great. Thank you for that great advice, Jamie. And so important, those skills, those interpersonal skills and the communication skills and those softer skills well, competency is so important as well, but it's those gifts that we have as nurses of empathy and kindness and treating our patients with dignity and respect are so important. Not only our clients, but their families and each other. So thanks for that, Jamie. So Suzanne, I think you're next.
Thanks. So I think we're kind of all on the same wavelength, because the first thing that came to my mind was to be kind to my younger self, be patient, to be able to take the time. I think when you're a newer nurse, I've been a nurse for almost 30 years, which sounds awful coming out of my mouth, actually. I thought people who had 30 years of nursing were really old and wrinkly and, I don't know what I thought they were, but it's not me. I have a few wrinkles. I have
Oh my goodness, I'm pushing 40, Suzanne. I better watch it.
Oh my gosh. But I think, I think back to all of my interactions, and I think as much as I appreciated them at the time, I don't know that I fully appreciated the impact that I had in those relationships with other team players and with patients. My favorite people right now in the world, other than nurses, are people with lived experience, and whatever that means. And I think I always gave time to people to tell their story. But I think that I didn't probably fully understand what that meant 25 years ago. And I think, really being present and hearing those stories and not knowing that you don't have to respond. It's okay to sit in silence. I think I was not good at being quiet when I was a new nurse. I thought I always had to be asking questions, and if I kept asking them, sooner or later I'd get an answer, and that them not responding meant they didn't understand me, when probably what I needed to do was listen more. So I think I would tell myself to listen more, to be more patient. And I think the other really important lesson I've learned over my life as a nurse is that it's okay not to know everything. And it's actually quite valuable in developing relationships with individuals, whether it's a community or a client or another colleague. If we don't know everything, if they can be the boss and they can teach us, that's a really amazing time to be present and be a nurse. Some of the most amazing conversations have been when there's been some appropriate self-disclosure. I can remember being taught as a nursing student, don't ever talk about your personal life, don't share anything, you can't, and that's wrong. But what I've learned actually is that advice is wrong. Especially when you have sort of longitudinal, long-term relationships with people, we're always asking them all these nosy questions about their life, their family, what's going on with them. And it's only natural for them to develop a rapport and a relationship with us and wanting to know how we are and what our family is like. And I think sometimes when we can say, I struggled with this, or I remember a time when I didn't know how to do this. I've had patients sort of say, really, and kind of be shocked by that. But it's actually a really refreshing to be able to acknowledge that I don't have all the answers and that I can say I don't know. And either I'm going to help you and we're going to find it out together, or I think you have the answer. And why don't you tell me what you think the right answer is? So I feel like I'm kind of rambling now, but there's been lots of things I would tell my younger self.
Yeah. Such wonderful advice. Thanks, Suzanne. And it's that vulnerability. I think you can still maintain that therapeutic relationship with your clients and still show that. And that's so important. Thank you. So Rena.
Yes. Oh, not sure.
I have goosebumps.
Yeah. I mean, Kimberly and Jamie and Suzanne pretty much summarized everything, I think. The one thing that, reflecting back on when I started as a nurse, and certainly do not have as much of the experience as Suzanne does, but echoing a few of her comments as well, is that I thought nurses did for, like you do for your patient, you do for your client, you do things, you are the doer. When in fact, and it's been definitely evident over the last 5 years in my practice that actually makes work a lot harder. It also leads to not as many successes as if you try to go with your client, go with your patient, meet your client or your patient or the population that you are working with, where they see their needs are. Because I mean, especially in my work as a nurse practitioner, I know what the target treatment goals are and things like this, but that might not be the client's treatment goals. And if you can work with rather than trying to do for your clients, I think that just sets yourself up for success. It sets the client's health up for success, and definitely helps with the relationship building. Echoing back to Suzanne's comment about just listen to your client population. The answers are there. What you think is best for somebody may not be the best for them. And I think I'll probably build on that even more throughout my career. But it would be very helpful to have known that at the start of my career and having that. And then lastly, definitely taking care of yourself. I think, we are caregivers, but if our tank is empty, there's nothing to give anymore. So recognizing that yes, we do things that we never thought were imaginable probably during these pandemic times. But having that acknowledgement that it's okay to ask for help, and that you don't have to do it all. So, yeah, thank you.
Great advice, Rena, and a great way to end that question. And it's interesting, you're each at different parts of your career, but yet still offered very similar advice, especially around that self-care piece. So very much important that we care for ourselves and each other. So thank you so much for that discussion. I wish we could talk for another hour here, but we're going to now open the questions from those that are participating in the webinar. So Carol, is there some questions?
I do have one right now. It says, how do you think the pandemic has or will influence the perception of nursing moving forward?
Who wants to start with that one?
I'm willing to start. I feel that nursing as a profession has just taken leaps ahead. I know when I started nursing 20 years ago, or a little over 20 years ago, we were very much kind of the helpers for a lot of things, not necessarily seen as the critical thinkers, those that can really take charge of situations. And I feel like the pandemic has really changed kind of the perception of nurses as being more like heroes, these superheroes that can do absolutely everything, and just the skills and everything that nurses have now, I think it's just really kind of become so much more apparent. And I kind of hope that helps more people to decide that maybe this is a career that they want to take part in the future.
Good, thanks, Kim. Does anyone else want to chime in on that? We don't have to have all of you unless you want to, but. Anyone
think
else in
that
terms
was
of
pretty-
perception? Oh, go ahead, Jamie.
Oh, I was just gonna say, I think that's pretty well stated. Just the respect and the awareness of what it actually means to be a nurse and all the different kind of roles that nurses have, I think has definitely been elevated.
Mhm. Great.
Yeah,
Suzanne?
I would just add, totally echo that. Sorry, that was Dr. Skinner popping in, being nosy to see who was on the screen. I think, nurse-led care, nurse-led programs, nurse-led support. I'm definitely going to connect with you, Rena, after this to talk a little bit more about RN specialty practice, because I think there are so many pieces that nurses can do going forward. And I think it is that nurse team approach, LPNs and RNs and nurse practitioners and psych nurses and educators, like all of us together moving forward, I think is going to make the change. I think I've always felt like nursing was a calling. It's a special piece of my life that I wouldn't change for anything. And I feel like this has absolutely highlighted that. I'm very proud that it's the nurses who have really responded. I was talking to one of the physicians who we were talking about staffing in the intensive cares a couple of weeks ago and how there had been some training for physicians ahead of what happened in the last couple of months, but they hadn't given any thought to the nurses and to the specialized training that ICU nurses require. And I just thought that was very interesting. I don't think that they'll forget again. I think they absolutely acknowledge the special roles that nurses have and the things that nurses can do with our patients, not to them and not for them.
Great. So Carol, I know there's a couple more questions that have come in.
There's a question here. It says, Rena spoke to RNSP. How can this be further operationalized? And it kind of sounds like Suzanne and Rena are going to have a discussion, which, will bring hopefully more RNSPs and, allow for more RN care. But I will let you ladies speak.
Yes, Rena, if you want to take that, and that the SRNA is here to assist in any way, and Barb McDonald would be happy to.
And she's on, so I'm sure she's very happy right now.
So Rena, how would you answer that?
I think that what Suzanne said about RN-led care, there are safe ways of doing this within our province, utilizing registered nurses. I must say the guidance of the SRNA and Barb McDonald has been immense in making me go from a little infant knowledge on RN specialty practices to operationalizing them specifically in the North. But I think that's a misconception that amongst our profession. I mean, I've worked in Southern Saskatchewan. Most of my registered nurse career was in rural Saskatchewan. And the opportunity for RN specialty practices throughout the province is huge. I think it's been a misconception that it's only in the North. You have to be a Northern nurse to do these things. That's not correct. I will boldly say that. And any provider out there, any registered nurse, whether point of care nursing or management, if they want to discuss kind of how that operationalized for us in the North, I think I would definitely be open to those discussions and the positive impact it's had, not only for the client population, which is at the core of it, but for that sense of that feeling that nurses get when they lead something and then they put it into practice and they have the authority to do that. I will say that it takes a great amount of support from your employer as the authority comes from your employer. And we've been very blessed with that in my workplace. That has made it much easier. But I think there's ways of people getting to know what RN specialty practices are. At a management level, perhaps. I'm not sure where the challenges are, but certainly I think we can support each other and work through those. Yeah.
Mm-hmm. Thanks, Rena. And it takes champions like you that will help move forward, and that optimization of registered nursing practice is so important and in the best interests of our clients. So really important. So Carol, we're nearing the end of our time, but is there another question? Or
I have another question, and then I just have just 3 comments that I can just read out, but I'll go with the question first. And Rena, you're on the hot spot again. When you were on isolation for COVID and Stanley Mission, did you resort to virtual, or what other resources did you use during that time to assist your clients?
Yeah, so we went to a virtual care model. The province was rolling out an app at the time, and the name escapes me. I'm sorry, I don't use it as much as I normally had been prior. So we used virtual care models. We did a lot of phone appointments as long as it was safe in delivering the care. At a minimum, we would have providers in the clinic. And so if through phone assessment, there was there was a need for in-person assessment, patients still had access to that. So PEXIP, I believe, was the app that we would utilize. And that came with some challenges, but then I actually also worked with the SRNA on processes for providing safe virtual care, and in collaboration with Canadian Nursing Protective Society, we were able to utilize technology through secure messaging and whatnot as well, which was hugely beneficial, especially with the patient population which I serve, because a lot of times that's the only way of getting a hold of some of the clients that I am part of their care. So that was helpful. And we still actually continue to do that for low risk appointment type things, stable patients with chronic disease management. And it has actually, I actually had a patient say the other day, knowing that I can just pick up a phone and leave a message or talk to a person directly for someone to call me back. And I think it's actually increased care quite a bit, increased access to care, and further has built rapport for sure. I'm not sure if I answered all of that. And it also has helped because we've had a large majority of patients also on isolation with two community outbreaks and our clinic outbreaks. So making sure that those people in isolation have been able to access care for their physical health, their mental health needs. We've actually adopted that as part of our everyday practice. So it's become quite normalized, and it works for the client, which is the key point, like Suzanne said before. Yeah.
Yeah. Great. So Carol, did you want to mention a couple?
Yeah, we've just got they're just comments. This person says, thank you for continuing to answer the call in these changing times. Happy Nurses Week to you all and to all the nurses working tirelessly throughout the healthcare system in response to the pandemic. We are grateful for each one of you. This is based on some of the conversation here about working with patients, not for patients. So the comment is, agree with not for. As a nurse with 30 years experience, that's what we were taught in school, that we were the expert. Now to see the changes in teaching new and upcoming nurses to work with the client, and that the client knows what's best for them. So thanks for that. And then the one other comment is somewhat related to RNSPs as well as our Facebook groups that we have now. I'm not used to this mouse, I apologize. There we go. Where is it? The new SRNA Facebook members group is a great place to connect with others for RNSPs and other topics. And as a bonus, join and participate in this group this week for some prizes to celebrate National Nursing Week.
There you go. Great plug for our SRNA Facebook groups. And yes, join and you can win some prizes. So we are getting very close to 1 here. Like I said, I'd love for this to continue. So this, though, I have to bring this National Nursing Week webinar Wednesday to a close. So thanks so much to our panelists, Suzanne, Rena, Jamie, and Kim, for joining us and sharing your stories with us. I had goosebumps through lots of the discussions. So thank you to those of you who are able to join us live today, and happy National Nursing Week to each of you. And thank you for all that you do. So thanks for joining us. So,
Thanks.
bye.
Bye.
Thank you, Carol. Thanks, Brad.
Thank you.